Hello everyone. So in last class we have talked about the factor affecting the body temperature. So further we will be talking about assessment of the body temperature. So how we are going to assess the body temperature of the patient. So body temperature may be assessed with a variety of devices like glass thermometer, electronic thermometer, or the disposable thermometer. So variety of thermometers are available in the market. As you can see, there are the glass thermometer, electronic thermometer, and the disposable thermometer. So this kind of devices are there which we have to use while we are assessing the temperature of the patient. So this we can consider as a type of the thermometer. So that is the glass thermometer, electronic, or else you can say the digital thermometer. Third one is a disposable, that is a chemical thermometer also. So in detail we'll be talking about each one. So first we'll talk about the glass thermometer. So the mercury is the glass thermometer is the most familiar. So in the glass thermometer, the main thing is or main component we can consider that is a mercury. So it is a glass tube filled at the one end with the mercury filled bulb. So here you can see this is the thermometer, glass thermometer. This is look like a the structure is look like a tube, okay, and the one end that is filled with the mercury and the other end is there, that is also filled with the mercury at the other. Then exposure of the bulb to the heat causes the mercury to expand and rise in the enclosed tube. So here what happens when the mercury comes in the contact with the heat, that time the mercury is going to expand and it is going to rise. So by that only you can understand whether the patient have the temperature or not. As you can see, they have a different readings has been given on the stamp side. So the length of the thermometer is generally marked with the centigrade calibration. So here the centigrade is also there, okay, and they have written the this all are the Celsius and this is the Fahrenheit. So the range is about 35 point Celsius degree and that is a 42 degree Celsius. So this is the normal range we can see, we can find over the thermometer. So the degree on thermometer are subdivided into gradient of the 0.1 degree Celsius. So here you can see they have written the 35, 36 and 37. So that is also one little mark is there after the 35, so that you can consider as a 0.1 degree Celsius. So after that it will be 0.2 degree Celsius, after that 0.3 and 0.4. So like that subdivision also has been given on the stem side of the thermometer. So the farthest point reached by the mercury in the tube is temperature reading. So here when the patient have the temperature, okay, when the patient have the fever, that time what happens, this mercury is going to rise like this and they will be going up at the other end of the this thermometer. So by that you will be having the reading of the patient's temperature. So the mercury will not fluctuate or fall unless the thermometer is shaken vigorously. So if you are shaking the thermometer very vigorously, then only that mercury is going to come down, or that after that only it will fall down. So if you want to check for another, if you have checked the temperature for the one patient and you want to go for the another patient, so before going to the another patient, make sure you are making the mercury at the lower side, okay. So three type of glass thermometer are also are the oral thermometer, axillary thermometer and the rectal thermometer. So there are the subdivision of the glass thermometer are also there. So in that three thermometers are there. The first one is the oral, second one is the axillary and third one is the rectal thermometer. So here they will be talking about how they will look like. So here the oral temperature we are talking about is the slender, allowing for the greater exposure of the bulb against the blood vessel in the mouth. So what happens here, you can see this is the oral temperature. Here you can see the bulb area is a slender also in a shape, and even though it is a wider also. So what happens, this part we are going to keep under the patient's tongue. Okay, so there under the tongue there will be the tiny vessels are available. Okay, so what happens if the patient temperature, if the patient have the temperature, that time the mercury is there inside the bulb, so it will come in the contact with the warmness and it will expand. Okay, so the axillary temperature is shorter and thicker than the oral type. If we talk about the axillary temperature or a thermometer, if we talk about, so that is in a shorter shape and it is a thicker than the oral side. So here you can see this is the oral thermometer, but this part will be shorter and this will be a little thick. So it can be used to measure the temperature at any site. So this thermometer we can use for assessing the temperature from any side. Okay, so here we are talking about the now, that is a rectal thermometer. Has a blunt and designed to prevent the trauma to the rectal tissue during the insertion. As you can see, this is the rectal thermometer. So the end is a blunt, okay, and it is a shape in the like a round shape is there. So why it is like that? Because if it is a sharp or if it is a slender in shape, so what happened? It is going to cause the trauma to the rectal tissue. So that's why while we are inserting, maybe it can have a it can cause a trauma or it can cause a injury. So that's why the rectal thermometer shape will be the it has a blunt shape. So what is the advantage of the glass thermometer if we will talk about? So that are available as the lowest priced. Then after wide availability, it will be available at any store, like medical store you can get it. Then after the reliable and the accurate or the accuracy, it means that whatever the reading is coming from that this glass thermometer, we can rely on that, we can trust that reading, okay, because that are the accurate temperature of the patient. And this thermometer also we can say the traditional thermometer also, okay, because in the before the time when the digital thermometer and that was not that time, they were using this kind of traditional thermometer only. So what is the disadvantage? That was the advantages, like it is available at the lowest price and it is a widely available, reliable and the accurate. What is the disadvantage for this? Like disadvantage of the mercury in the glass thermometer are time delay for the recording. So if we keep if we are checking or if we are assessing the temperature from the glass thermometer, it will take a time. Why? Because when the mercury will come in the contact with the heat, that time only it is going to expand. Okay, so maybe it will take a time. So it is a little time consuming process. So that's why. And easily breakability. As you can, as we have seen earlier, this mercury is not going to fluctuate or not even going to fall down unless if you shake the vigorously. If you are shaking very vigorously, then only that mercury is going to come down. So while we are doing this process, that time maybe the thermometer can slip from your hands. So by that also it can break. So that is the disadvantage of the glass thermometer. Now we'll be talking about the electronic and the digital thermometer. So the electronic thermometer consists of a rechargeable battery powered display unit. So here you can see display unit is there where they will be showing the reading of the patient. Okay, as you can see 35.5 degree Celsius. And thin wire cord and a temperature processing probe covered with the disposable plastic sheet. So here you can see inside this there will be the wiring. Of course there will be the wiring because this is the electronic one, right? And here one probe bulb is there and it is made up of plastic sheet. So one form of electronic thermometer uses a pencil like a probe. So like a pencil, you can say this is look like a pencil only. Separate non-breakable probe are available for oral and the rectal use. So separately non-breakable probes are available for the oral also and for the rectal also. So the oral probe can also be used for the axillary temperature measurement. If oral probe is there, that also you can use for the axillary temperature also. It is not necessary that you should have another separate probe for the axillary. If you have the oral probe, that also you can use for the axillary purpose also. Then within the 20 to 50 second of the insertion, a reading appear on the display unit. So it takes only about the 20 to 50 seconds. When it compares to the glass thermometer, it takes time to do the processing, right? So this is the advantage of this digital thermometer. So it takes only 20 to 50 seconds to know the temperature of the patient. So a sound signal when the peak temperature reading has been measured. So when this probe is coming contact with the heat of the patient's body, that time when they are reaching at the peakest level, when it is the highest level temperature, when it reach, that time it will have a beep sound. So that time you have to understand the temperature has been recorded. So this here the on off button will be there, that you have to press it, then it will be on, then after only you can insert from that time you can have from the oral side, otherwise from the axillary side. Then another form of the electronic thermometer is used exclusively for tympanic temperature. So tympanic temperature, it will be like we are checking the temperature from the ear pinna. From the ear side we are taking the temperature. So otoscope like speculum with an infrared sensory tip detects the heat radiated from the tympanic membrane. So here what will be there, like the otoscope. Here you can see this is the tympanic thermometer. So here this kind of tip will be there, that will be inserted. Here you can see this is the ear pinna, they will be inserting here. So from the ear pinna, or we can say the auditory canal is there, from there the heat will be produced. So by that also you can measure the temperature from the tympanic membrane. So otoscope like a speculum with the infrared sensory tip, so that is known as an infrared sensory tip. So detect the heat radiated from the tympanic membrane. So as you have seen from that tympanic membrane, this tympanic membrane is there, or the auditory canal is there. From there the heat will be produced. So within the 2 to 5 seconds of the placement in the auditory canal, a reading appears on the display unit. So it takes only 2 to 5 seconds to know the temperature of the patient. So you just insert and wait for a 2 to 5 seconds, and you will have a reading of the patient. A sound signal when the peak the temperature reading has been measured. So when it is here also they will have a beeping sound. So when the thermometer reaches the highest temperature of the body of the patient, that time it will start to beep. So you have to understand that the temperature has been recorded. So the advantage of the electronic thermometer are that they can be inserted immediately. The readings appear within the second, and they are easy to read. So what is that? So here, as we have seen, it takes only few seconds to know the temperature. So that is the advantage of the this tympanic thermometer. And they are easy to read very easily, because that is a digital. So on that you can have numbers. Okay, so you can read it very easily. But when it comes to the glass thermometer, that time you have to understand where the mercury has stopped. By that only you have to read it, and you have to understand, okay, this is the point where the mercury has stopped, and by that you can record the temperature of the patient. So what is the disadvantage of this? Their expense is a major disadvantage. So this is the tympanic thermometer is really expensive, we can say. So that is a most disadvantage of the thermometer. Now we'll be talking about the disposable and the chemical thermometer. So disposable and single-use thermometer are thin strip of the plastic with chemically impregnated paper. So here as you can see, this is the disposable thermometer. So here they will be, it is made up of plastic only. So they will be showing this kind of readings, and in that, inside of this there will be the chemical. So they are used for the oral or the axillary temperature. So this paper or a strip you can use for the axillary or else for the oral. Particularly with the children. So mostly this kind of thermometer we are using for the children. So they are inserted the same way as the oral thermometer and used only once. If you are checking from the oral side, so how we are inserting for the oral thermometer, that same way we have to insert this disposable thermometer for the children also you can use. Then chemical dots on the thermometer change color to reflect the temperature reading, and only 45 seconds are needed to record a temperature. So here you can see, as we have seen, okay, so this dot line they are showing, okay, so they are showing the temperature of the temperature they are showing, and according to the temperature of the body they will be indicating. So if it is this, so that will be filled. So chemical dot on the thermometer change color to reflect, so they will change the color. By that only you will be able to understand, okay, the children having this kind of temperature, or the patient have the maybe 98.6 degree Fahrenheit. So, and only it takes about the 45 seconds to record this temperature. So another form of the disposable thermometer is a temperature sensitive patch. So here another type of, or another form we can say, so that is the temperature sensitive patch, or else you can say the tape, applied to the forehead or the abdomen, and the patch changes colors at the different temperature. So here patch, otherwise you can say the tape also. So that will be that you can apply over the forehead, otherwise the abdomen. So both forms of the disposable thermometers are useful for the screening temperature, especially for the newborns. So mostly we are using for the children, newborns or the neonates. Okay. So that was about the different assessment of the body temperature and different type of the thermometers. So now we'll be talking about the temperature scale. So if you have the only Celsius temperature, so maybe they will be showing only Celsius on their temperature, and you want to convert into the Fahrenheit, and you want to know in Fahrenheit how much it will be. So here the scale has been given, so you have to calculate according to that. Okay, so in that first one we're talking about to convert from the Fahrenheit to Celsius. If we have the temperature reading in the form of the Fahrenheit, but we want to know in the form of the Celsius, so what we have to do? So deduct the 32 from the Fahrenheit reading and then multiply by the fraction of 5 upon 9, that is, so here that is we want to know in the form of the Celsius. So C is equal to in bracket Fahrenheit temperature. So in Fahrenheit temperature, if we take about the 98, okay, so 98 minus 32 you have to do, then whatever the reading is coming, multiply by the 5, okay, then whatever the result is coming, that you have to divide it by the 9. So you will have the reading that will show in the Celsius. Now if we want to convert from the Celsius to Fahrenheit, now we have the reading in the form of the Celsius, but we want to convert into the Fahrenheit, or we want to know how much it comes for the Fahrenheit. So that time what we have to do, multiply the Celsius reading by the fraction of 9 upon 5, then the add 32 is. So in this Fahrenheit we need to know, that's why. So is equal to in bracket Celsius temperature. So it will be in the form of 35. So 35 multiply by the 9, whatever the reading is coming, divided by 5, then whatever reading is coming plus do the 32. So you will have the reading in the form of the Fahrenheit. So here one table has been given. They have shown if it is a 34 degree Celsius, then it will be 93.2 degree Fahrenheit. So here the number of reading has been given. If you will convert, if you will use this formula, then you will have the exact reading like this. Now we'll be talking about the alteration in the body temperature. So what kind of alteration can be there in the body, that we'll see. So body temperature may be within the normal range for one's age, or it may be increased or decreased from the normal range. As we know the normal range of the temperature, if it is going up, then it is also it is going to cause the problem, and if it is less, then also it is going to cause the problem. So it has to be within the normal range. Okay, so these changes can be related to excess heat production. So this changes, why this changes is coming? Because maybe the body is producing excess amount of the heat, so that is the one reason. Otherwise, excessive heat loss, maybe body is losing extra amount of the temperature, so that is also another reason. Then after minimal heat production, maybe a body is producing minimum amount of the heat, so that is also a reason. Then after minimal heat loss, maybe how much amount of the body has to lose the heat, maybe it is not doing that way. So that is what, and any combination of this alteration. So maybe as we have seen the different kind of variety of the heat production and heat loss, if something is coming and there is a combination between that also, so this all are the reason for the alteration inside the body. So the nature of the change affect the type of the clinical problems a client experiences. So the nature of change affect the type of the clinical problem, like so if a patient is going to have any problem, or if they have the infection or something, so this kind of variation the patient is going to experience. So a body temperature above the usual range is called as a fever. So when we know the normal range, if it is going more, or if it is rising in the temperature, okay, so maybe that is known as a fever. So it occurs because heat loss mechanism are unable to keep the pace with the excess heat production. So here what happens, why this is happening? Because the heat loss mechanism is there inside the body, maybe it is not working properly. Okay, so as we have seen earlier, the heat production and heat loss, that both the process has to work simultaneously. If they are not working, then only the alteration will be there inside the body, so resulting in the abnormal rise in the body temperature. So because of this, when the body is not losing proper amount of the heat, that time the patient is going to have the fever. So now we are going to talk about the fever. What is that? So a body temperature above the usual range is called as a fever. So whatever the normal range is there, if it is going if it is increasing than the normal range, then it is known as a fever. A person with the increased body temperature is said to be febrile. So that has to be known as a febrile. So it also responds to the bacterial and the viral ingestion. So if any viral or any bacterial infection is there inside the body of the patient, that time also the temperature of the body is going to rise. Now the phases of the fever. There are the different phases are there that we'll talk about. So first one is the invasive or the onset. So what is that? It is a phase of the starting of the rising. So this is the first stage of fever where the body is getting the temperature. Okay, so that is the first one, or the fasting or the stadium. So in that what happened? In this phase, a fever reaches its maximum degree and remains constant at the high level. So what happens? At the first stage, it has started to rise the temperature. But in second stage or in second phase, what happens? The fever will reach at the peak level of the maximum degree. How much the maximum degree is there of the body? It will reach. Okay, and it will remain constant at the high level. So maybe for the few days, it will be same as a high temperature. So that is the second phase. Then after the third one is a decline. So in this phase, the high temperature comes back to the normal, and it may be sudden or the gradual. So in the decline, what happens? It has reached, in the previous phase, it has reached at the peak level of the degree of the body. So and maybe for the few days it is going to be constant. It will be continuously, it will be same. But after that, some point of time, it will try to reduce, gradually it will reduce it. So that is the phase of the decline. So whatever the body temperature is at the higher temperature, so it will try to come to the normal temperature of the body. Then after fourth one is that crisis. So it means a sudden decrease in temperature. So maybe what happens, maybe gradually it is not, maybe for some patient it takes time to reduce or subside the temperature. But in crisis, what happens, suddenly it will fall to the temperature. So it may take few hours or day in, so maybe it takes only few days, otherwise a few hours to come at the normal range of the body. So in the true crisis, there will be the improvement in the patient's condition. So in true crisis, what happens, it means that if it is coming down, so generally the body's condition or the patient's condition is also going to improve when the simultaneously the temperature is also going to reduce. So that is known as a true crisis. But what happens in the false crisis, there is a no improvement in the patient's condition. So here maybe the temperature is not rising, or temperature is constant, but maybe the temperature is less, but the patient's condition is not improving. So that is known as a false crisis. Two crises are there. One is the true crisis and the another is a false crisis. In true crisis, what happens, the general condition of the patient is going to improve, but in false, it is not going to improve. Then after the lysis, so it means a gradual decrease in a temperature. So gradually it is taking time. Maybe it takes a few days or weeks to come to the normal. So maybe it takes 2 or 3 days. So it takes 2 or 3 days to come at the normal range of the body temperature. So these all are the phases of the fever. Now we'll be talking about the types of the abnormal fever or the abnormal temperature. So in that first one is that hypopyrexia or the subnormal temperature. So hypopyrexia, hypo it means it is a low, and hyper it means it is a higher. So the temperature falls below the 97 degree Fahrenheit or the 37 degree Celsius. So the temperature will be fall below this limit. That is known as a hypopyrexia. Otherwise, it is known as a subnormal temperature. Then after the low pyrexia, what is that? So temperature ranges between the 99 to the 101 degree Fahrenheit. So the patient might have a little fever. So that is what whatever the temperature will range between this two, 99 to 101 Fahrenheit. Okay, so that is known as a low pyrexia. Then after third one, moderate pyrexia. So what is that? So temperature ranges between the 101 to the 103 degree Fahrenheit. If it is the patient is having like that temperature, then it is considered as a moderate pyrexia. Then after fourth one is a high pyrexia. So temperature ranges between the 103 to 105 degree Fahrenheit. So here the temperature is rising. So that is known as a high pyrexia. Then after the hyperpyrexia, what is that? So temperature goes above the 105 degree Fahrenheit. So if it is more than that, so that is known as a hyperpyrexia. Then after, what is the constant fever? So body temperature remains almost same with a slight variation of the 1 to 2 degrees. Okay, so what is known as a constant fever? So all the time, maybe it is whatever, if it is a day, if it is a morning, or if it is a 9 or noon, or maybe every 2 or 3 days, the patient is having the same constant fever. So maybe a little variation will be there, like a 1 to 2 degrees. So that is known as a constant fever. Then after remittent fever, so there is a variation of more than 2 degree in the morning and evening temperature, but temperature never falls to normal. So remittent fever, what will be there? So there is a variation of more than 2 degrees. In previously we have seen that is a constant fever, that will be the variation comes like 1 to 2 degrees, but here more than 2 degree variation will be there. So in the morning and the evening temperature, if we take the morning temperature, maybe it was like 98.6, but when we checked in the evening time, that time it came the 99 or 100. So that you can consider that is a remittent fever, but this will never come to the normal range of the temperature. Then after the intermediate fever, so there is a great variation in the temperature. Here the great variation will be there, not even more than 2 degrees. There will be the more maybe 4 or 5 degrees variation will be there. So temperature rises very high and may fall regular interval. So sometime it is a very high level of temperature, and sometime it is coming fall at the regular interval. Maybe it takes a 2 to 3 hours and again it is coming down. And when we are checking after a little hour, then maybe it is a raised. So this type of fever is seen in the malaria cases. When the patient is suffering from malaria, that time they will have this pattern of the temperature. So that will consider as a intermediate fever. Then after relapsing fever, so what is that? Is one in which there are a brief febrile period followed by 1 or 2 days of the normal temperature. So in this what happens, maybe at the starting point of time, they will have the temperature, but after the 1 or 2 days they will have the normal temperature, and again they are going to have the high fever. So that is known as a relapsing fever. Then after, during a constant fever, the body temperature fluctuates minimally but always remains above the normal. So during we are talking about the constant fever. So here what happens, the body temperature is going to fluctuate, but it will always remains to the normal, above the normal. And this occur with the typhoid fever. If the patient is suffering from the typhoid, then this kind of pattern of the fever or the temperature you can see in the patient. Then after the inverse fever. So in this, the highest range of the temperature is recorded in the morning hour and lowest in the evening hours, which are contrary to the found in the normal course of the fever. So here we are talking about the inverse fever. So what happens in this, the highest range of the temperature is recorded. So when we are checking at the morning time, that time they will have the highest fever. Okay, and when they are coming, when they are checking in the evening time, they will have the lowest fever. Okay, so this kind of normally you can find when the patient has some infection. So this is the commonest type of fever we can see for among the patient. Then after the rigor, so it is a sudden severe attack of shivering in which the body temperature rises rapidly to the state of hyperpyrexia as seen in the malaria. So what happens here, the patient will have a temperature also, but simultaneously they will be having the shivering also. So temperature will be raised and the shivering will be there. So that is known as a rigor. So after that, irregular fever, when the fever is entirely irregular and in its course, and it cannot be classified under any of this fever described above. So maybe the patient is having certain kind of fever, but whatever we have seen the type till now, maybe it is not including, or we are not able to identify what kind of fever the patient had. So that we can consider as an irregular fever. Then after crisis, so crisis is a sudden return to the normal temperature from a very high temperature within a few hours or days. So in this, what happened in the crisis, the patient is having the highest fever like the 105 or more than 105, but suddenly it is coming to the normal range of the temperature. So maybe it takes a few days or the hours. So that is known as a crisis. So here the true crisis and the false crisis. The temperature falls suddenly within the few hours and touches to the normal. So within the few hours, it takes only a few hours and it will come to the normal ranges, and accompanied by the marked improvement in the patient's condition. So here what happens, the general condition of the patient is also going to improve. So that is known as a true crisis. And in the false crisis, what happens, a sudden fall in the temperature not accomplished by the improvement in the general condition. So here a sudden fall, there will be the patient won't be having the fever. Okay, maybe the patient had the highest or high grade fever. After some time it has reduced, but the general condition of the patient has not improved yet. So that comes under the false crisis. Then after the lysis, the temperature falls in a zigzag manner for a 2 to 3 days or a week before reaching to the normal. So here what happens, in the lysis, the patient is going to reduce some kind of temperature, or the temperature will fall, but it will be like in a zigzag manner. Maybe sometime the patient will have a highest fever, and maybe after a little time they will have a lower fever. So like the zigzag manner, the patient will have the temperature. So within the 3 or 4 days, otherwise for the week, they will have the same kind of temperature, but after that it will come to the normal state or the normal range of the temperature. So that is known as a lysis, during which time the other symptom also gradually disappear. So here we are going to consider as a general condition also. So when it is coming to the normal, okay, that time whatever the another symptoms are associated with that, it is also going to reduce. So it will disappear. Okay, now the clinical symptoms. What kind of symptoms you will be see? What kind of symptoms will be there according to the system if the patient have the alteration in the body temperature. So first we'll talk about the respiratory system. So how the temperature is going to affect the respiratory system and what kind of symptoms you can see. So the shallow and the rapid breathing. So breathing will be very rapid and it will be shallow breathing. Then after the circulatory system, increased pulse rate and the palpitation. The pulse rate will be raised and the patient will have the palpitation. Then after eliminatory system, dry mouth, coated tongue, loss of appetite, indigestion, then nausea, vomiting, constipation and the diarrhea. So this kind of symptoms you can see in the eliminatory system. Then after the urinary system, diminished urinary output will be disturbed. Then after burning micturition will be there. When the patient is going for the passing the urine, that time they have the burning sensation. So that is known as a burning micturition. Then after the dark colored urine, so that will be the dark concentrated urine will be there if the patient have the fever. Then after the nervous system, there will be headache. Then after restlessness, patient will be very restless. Then after irritability, patient will get very irritation. Then after insomnia, that is patient won't be able to sleep properly. Then after the convulsion and the delirium. Convulsion maybe will be there when the patient the temperature is rising more than the 105. That time maybe the patient will have the convulsion or the fits. Then after the delirium, that is a confusion kind of state. The patient won't be able to understand. So patient will be in a confusion state. Then after the musculoskeletal system, the malaise will be there. So that is a general discomfortness will be there. Then after the fatigue, patient will have a restlessness. So of course the patient will be like, oh, I'm not feeling so energetic, maybe I'm very restless like that, or patient will say I'm feeling very weak. So that is a fatigue. Then after the body pain will be there and the joint pain. Then after the integumentary system, so in this heavy sweating, maybe sweating will be more. Then after the hot flushes, so hot flushes you can see in the like the patient have a at the night time, the patient will have a more sweating. Okay, when the surrounding or the weather is cool, but still the patient is having the sweating or severe perspiration, we can say, that is known as a hot flushes. Then after the goose flash, then after shivering or the rigors. Goose flesh, that is known as when the patient have a severe perspiration, that time small pimple or the bumps will be there on the surface area of the skin. So small that is filled with the fluid also it can be filled. So that is because of the severe perspiration. So that is known as a goose flesh. Small bumps will be there on the surface area of the skin. Okay, now the assessment of the patient with the fever. Now the patient have the fever and you are going to assess the patient. So what kind of things you have to keep in mind, that we will talk about. So first of all, history. So take the history properly. Then only you will be able to understand since when the patient is having this kind of symptoms. So in that, medical history including any chronic or the immune compromised disorder. If patient having any medical disorder, okay, or the any immune compromised disorder like the cancer, otherwise the HIV, AIDS. So this kind of patient have the infection, that time also patient may have the fever or any chronic illnesses are there. Then after the recent hospitalization, surgeries and the medication. If the patient has gone from any surgery, maybe if they have gone for surgery, might be they can have a certain kind of infection. So because of infection, as we have seen the bacteria and the viruses, if they are entering inside the body, that time also body temperature is going to rise, right? Then after the hospitalization. Hospital is the premises or the, we can say the one kind of premises where we are getting the number of infection will be there. So if the patient has gone from the hospitalization for any reason, so that time also they can have some hospital acquired infection. So because of that also they have a fever. So take proper history and the medication. There are some medication because medication will have some side effect. So maybe because of that the patient's body temperature will be rising. Then after occupational history. Occupational history is like when the patient is working in some factories or any food process or any medication factory where they are making this all the things. So that time also they can have they will be exposed to the extra heat. Okay. Then after as we have seen the in a radiation, whatever the radiation is coming, by that also the body is going to absorb that all the heat. So radiation is also going to affect. Then after if they are working in the factory or something, that time they can have the fumes. Then after any dust or something, so by that also they can have the fever. So occupation history is also going to affect the body temperature. Then after exposure to infection agent. So if the patient have any kind of infection like bacteria or viruses, there are also subdivision of the bacteria and viruses. So make sure you are taking the proper history. Then after febrile or the infected individual in home or the workplace. Maybe sometime some infection are there which is contagious. So maybe that can spread very easily. So if someone is having common cold also, that time also it, if there is a in family member, if someone have the common cold also or coughing or sneezing also, that also can spread to the another member of the family. So maybe this is also mode of infection we can say. So make sure you are asking about this also. And the workplace, maybe they are working at the certain places, that time if the some colleagues are infected or they are ill or they are sick, that time also this can be spread. Then after use of tobacco, if the patient is having a tobacco, then after any IV drugs is going on, then after any trauma a patient had, then after any animal bite, then after the immunization. So as we know, as we have talked about the medication, if patient is taking certain kind of medication, they may have the side effect of the fever. So that can be there. Then after the trauma, if any trauma has happened, any injury or any accident has happened, so because of that also the body temperature is going to alter. Then after the animal bite after biting the animal or anything like a dog or something, so that time some viruses will be there inside the saliva of that animal. So when the animal is biting, so what is happening, that all the virus or the bacteria that is going to enter inside the body of the patient or the human. So that time the temperature will be rising. Then after the immunization, so maybe there will be the two kind of vaccination are there, live vaccine and the if the live vaccine is there, so what happens, they are injecting the live bacteria or viruses. So after immunization also, when they are getting the vaccine, after that also they will have the fever. So make sure you are taking the proper history. Then after family history of the TB, if the patient any member or a family member have the tuberculosis, make sure you are taking the history. Then after arthritis, then infectious disease and the anemia. So this all are the history which you have to take very detail, and make sure you are asking all the detail when you are taking the patients when you are doing the assessment. Then after the physical examination, first was the history. Now we'll talk about the physical examination. So check the vital sign. First we have, this is what as I've said in the introduction, when the patient is coming to you as you are working as a nurse. So if you are employed in the hospital, if you are employed in a emergency ward or in a simple ward also, first your responsibility is to check the vital sign. If you are checking the vital sign, you will be able to understand what is the status of the hemodialysis as we can see. So that will be as we know, the vital sign are we are recording of the vital organs. So how well the vital organs are working, we will be able to understand by checking the vital sign. So that is your first responsibility, to check the vital sign. Then after the skin, then after the lymph nodes, then after eye, then nail beds, CVS, that is a cerebrovascular system. Then after chest, abdomen, musculoskeletal system, nervous system should be carefully examined. So here we are going to check all the system, as we have seen the clinical sign or clinical symptoms. If a patient have fever, what kind of symptoms you can see according to the system. So that's why for knowing this all the symptoms, you have to do the physical examination. So physical examination start from the head to foot assessment. So each organ will be included, each system will be included. So you have to do very carefully this physical examination. Then after pelvic examination for the PID. So that is a pelvic inflammatory disease. So any patient have any surgery or previous surgery, any pelvic surgery if they have, so make sure you are taking the history for the PID also, that is a pelvic inflammatory disease. Then after the auscultation, so in that, change in the cardiac murmur indicate the endocarditis. So when we are ausculting, when we are listening the sound of the heart, okay, so that time there will be also abnormal sounds are there, like the murmur sound. If the murmur sound is there, so make sure you have to understand that indicates that endocarditis. Then after pneumonia and the pericarditis and the pleuritis. So this if this all the condition are there, that time we can listen the murmur sound from the heart. Then after then the palpation of the abdomen. So we have to do the palpation of the abdomen also. So by that, what we will be able to understand, that is a hepatomegaly, then after a splenomegaly and abscess or the mass. So this also will be able to understand. Then after musculoskeletal system, so in that arthritis and the osteomyelitis. So this kind of condition also we have to check. Then after the neurology, that is a meningitis. So this all are the condition which we have to make sure we are assessing while doing the physical examination. Then after the laboratory test, this is the third step we have to do. First we have to take the proper history, second one is a physical examination, and third one is a laboratory test. So what kind of test we have to run when the patient have the fever, complaint of the fever or the history of the fever. So if the patient reveals more than a simple viral illness or the pharyngitis, then the lab testing is done. So maybe the patient is having more than 5 or 3 days or 7 days fever. So that time we have to do some test. Okay, or the patient have the pharyngitis, that time also. So clinical pathology includes, so what kind of test we have to do? So that is a CBC, that is a complete blood count. So in that they will be checking all the different blood have a different components. Okay, different like they will have the differential count, then after platelet count, then after red blood cells are there, white blood cells are there. So this all are the composition, or we can say the component of the blood. So that will be seen in the CBC, that is a complete blood count. Then after DLC, that is a differential leukocyte. So leukocyte also we have to see. Then after the blood smear examination for the pathogen, if you want to know which kind of pathogen is responsible for this particular disease or particular infection, that time also we have to do some test, because according to the virus and the bacteria, they have a different treatment also, okay, according to their agent we can see. Then after the ESR, that is the erythrocyte sedimentation rate, shows the inflammation present in the system. So ESR is also important to do when we want to know where is the inflammation is and how much rate how much rate of the infection is present inside the body. So they will be showing in the ESR. So this all the tests we have to do for the laboratory. Then fourth one is a radiology. So radiology, it contains the most probably X-ray. So chest X-ray is done for the significant febrile illness. If the patient have a severe illnesses, if there is a history of the TB, so that time, or the pneumonia if they have the patient, so that time you have to do the X-ray of the chest. Why? Because by that you will be able to understand the lungs, how much they are affected.